Being addicted makes you somebody you didn't used to be. I know. I wasn't myself. I did things and said stuff to people I wouldn't have done before. It was like I was two people, and the second one really took over.
It seems as though I've been struggling with this all my life. One day just rolled into another. Wanting to be high was all that I knew, nothing else.
Seeing my daughter come home intoxicated day after day was tearing our family apart. I knew that if I didn't get help for her now, we were going to lose her, and she would take us all down with her.
I hid my drinking for years, or I thought I was hiding it. My wife let me hide it, and so did the boss. But then I had that bad weekend, really went off on the kids. A week later, I got the DUI. My wife finally said she was going to leave with the kids unless I got some help.
Today, as many as 1 in every 4 households is challenged in some way by alcoholism or a drug dependency. It's not a problem affecting only the down and out or the celebrities you hear about. It's a middle-class crisis. It could be someone in your family, a neighbor, the parent that drives your children home from practice, a respected member of the community. It could be you. But you should know that help is available. That means there's hope. While nobody chooses to become an addict, you can choose recovery with the help and hope found at Livengrin. Founded in 1966 as one of Pennsylvania's first nonprofit treatment centers for alcoholism and drug addiction, Livengrin Foundation is situated in a serene, green setting in Bucks County outside of Philadelphia. It's a quiet and safe place, away from the temptations and the old familiar environment that could trigger a person's craving for drinking or drugs. A place to concentrate on getting better. Livengrin provides what is called the full continuum of care. This means that no matter what point that a person needs to receive treatment, from the medical detoxification that removes toxins from the body, through inpatient treatment for up to 4 weeks, to the outpatient programs that help a person keep going on the right track, and supportive aftercare services and relationships. Livengrin is complete, professional, and affordable. It's real rehab for real people.
Addiction to alcohol or drugs is an insidious and progressive illness that affects the individual physically, emotionally, and spiritually. It's also non-discriminatory and can impact people of any age, race, ethnicity, gender, or socioeconomic background. Although we know that no one makes the choice to become addicted to alcohol or drugs, they can and need to make the choice for recovery. Here at Livengrin, our professional staff will work with each individual and their family to develop a treatment program designed specifically to meet their needs as they begin the road to recovery.
Research and experience have proven that a person in recovery has a much better chance of success if there is support and understanding from their loved ones. Livengrin includes the patient's family in the process because, it's fair to say, they have to make their way back from a difficult place too.
They're scared, they're fearful, they're oftentimes feeling so many different types of emotions: anger, frustration, sadness. And after meeting with them for just a little while, I see a sense of relief. You can just see a change in their face and their body language. But my biggest joy comes when they leave and get to see their smiles back on their faces and the light back in their eyes. I really feel I get to see people come back to life before my very eyes, and that does bring me much joy.
My daughter was doing drugs. That was the beginning of 10 years of hell that our family went through. But we went in and out of 8 different rehabs before coming here to Livengrin. And I thought I knew it all between counseling and support groups and what I learned from my daughter being in the rehabs. This was the first facility that ever took the time and made an effort to really work with the family and help the family understand.
Livengrin is a resource not just for the individual, but for the entire community. Physicians and therapists make Livengrin a partner in treating their patients. Dependency on alcohol or drugs is a primary illness in itself and is often the underlying reason for other physical and psychological conditions. In the workplace, the individual tries to hide their problem, even though the folks at home may know about it. That's why human resource managers, unions, and owners of businesses of all sizes called on Livengrin for help to treat the disease and return the person to work as a valuable employee. Many addicts and alcoholics end up in trouble in the legal system. Livengrin is a key resource for probation officers, attorneys, and criminal justice professionals, providing both treatment and education that prepares the individual to take responsibility for acting as a sober, respectable member of the community. Because almost anybody can be susceptible to addiction, Livengrin is at the vanguard in creating new treatment programs. One addresses the special challenges of nurses and other healthcare professionals with dependencies. Police, firefighters, and other first responders who can go through extraordinarily stressful experiences can find help with their addictive behaviors in the FRAT program, a treatment service managed by Livengrin staff and including an experienced active duty officer. Part of what Livengrin offers is the compassion and respect that everyone deserves, especially those who have lost hope and feel overwhelmed. While we don't insist on any particular religious or spiritual theme, we do our best to show patients that there is a spiritual element to recovery, to help a patient find a connection with the world and with a higher power in which the person can place some faith.
I pretty much started drinking when I was 15 years old. I was sophomore, junior in high school. Drinking became a big part of my identity. The staff at Livengrin, from day one when I came into treatment, treated me with respect. And I remember thinking at the time, like, I hadn't gotten those feelings in other places. What I learned here was that I could be a selfless individual and, walk out in the morning and just be part of, but not just part of a recovering community, part of the world. I wake up in the morning and my thought isn't where I'm going to get my next drink. It's no longer my waking thought. My waking thought is what I need to do to maintain this gift that I've been given.
Careful planning by the Board of Directors ensures that Livengrin is always innovative in meeting patient needs. In one important achievement, new rehab residences give patients a comfortable environment that brings the feel of home life a little closer. Everyone coming into Livengrin's residential program benefits from balanced, healthy meals and 24-hour nursing and medical care. Every patient is matched with a personal counselor who develops and oversees an individualized treatment plan. The counselor helps to bring about a new clarity within the patient, a spark that reveals he or she is coming to understand their addiction and is willing to begin the process needed to overcome it. A part of every patient's learning is a 12-step program based on abstinence. The well-known 12 steps offer a path to self-awareness. With the support of others following the same path, a person can find the steps provide a basis for a new way of life. This program is proven to be a time-tested way for a person to understand the disease and manage their lifelong recovery. The complete continuum of care includes a variety of outpatient services for people who continue to receive help while carrying on with their daily lives, and an adolescent program to help young adults. The Livengrin website is there 24 hours a day as a resource to help people find answers and stay connected to recovery. Patients can also get the help and information they seek by calling or visiting one of the Foundation's counseling centers at convenient locations in Bucks, Philadelphia, Montgomery, and Lehigh counties. Of course, Livengrin serves people from all over the country.
Treatment is only the beginning of the recovery process for the patients that we have here at Livengrin. As a matter of fact, once they leave the facility, that's where the recovery process really begins. Aftercare sessions, reunions, and 12-step meetings are all a part of the recovery process and the continuum of care that we provide here at Livengrin. Research and our experience show the more engaged an individual is with others who are also experiencing recovery, the better their chances for success.
No one chooses to become dependent on alcohol or drugs. But you can choose recovery. Safe, secure, compassionate, professional, and affordable. Livengrin can be the first step on the road back to a normal, joy-filled life.